Our next speaker is Canberra's worst neighbour. She is a rock drummer, a kung fu instructor and a registered nurse, which means she makes a lot of noise. When you come over to complain about it, she can hurt you, but don't worry, she's a registered nurse and she can also patch you up again. She likes to practice quality of life as well as researching quality of life. From the Faculty of Health, please welcome Dr. Kasia Bail.
Everyone, put your hands in the air. Just that little bit of exercise means that I have helped you prevent future disease, because that is what nurses do. As a nurse, I analyse large hospital patient data sets, and I found that complex older people get twice as many complications, things like pneumonia. These complications are expensive. In just one state, in 1 year, they cost $225 million. Those costs and the suffering could be prevented, but they don't take fancy medications to prevent them. They take nurses who simultaneously assess and intervene. Unfortunately, up to about 95% of nurses report leaving at least one care task undone on their last shift. They don't have time to get their patients to put their hands in their air, let alone walk them around with an IV pole, urine drain, chest drain. I need $7,000 so I can access and analyse government-owned databases. I need to use my knowledge to make sure that the Health Commission understands complications, like I do, to make sure we're setting the right KPIs to achieve quality healthcare for us all. Do you want efficient use of taxpayer dollars in healthcare? Then put your hands in the air.
Thank you. Lovely and very achievable. My question is around compliance and reporting. Are you sure that reporting is done consistently across the jurisdictions?
Thank you. It's a very good question. No, we know that it's not. The method that I use to collect adverse events is an approach done by Needleman in the States. Partly what I'd like to do is to compare that to the condition onset flags that are currently used in hospitals. We know that condition onset flags are probably under-representation of what actually occurs. The way I collect it is an over-representation, probably. So we need to compare the two and try and keep refining the science and actually articulating that this is something that we can do. Partly the issue is that for older people in hospital, we sometimes term these as geriatric complications, so things like pneumonia, urinary tract infections. So partly creating a discourse which enables these as preventable is really important. Thank you.